Hi, everyone, and welcome to Ask the Horse Live. I'm your host, Haley Kerstetter, digital editor at thehorse.com. Osteoarthritis, or the degeneration of cartilage that lines the bones inside a horse's joints, accounts for 60% of all lameness cases and contributes to massive economic losses for horse owners. Understanding how to recognize the signs of osteoarthritis and manage horses with joint disease is crucial to their health and well-being. This event is sponsored by American Regent Animal Health. To answer your questions tonight, we're joined by two expert panelists, Dr. Steve Adair from the University of Tennessee and Dr. Helen Mansfield from American Regent. Welcome to both of you.
Thank you. Glad to be here.
Thanks, Haley.
Dr. Adair, can you tell us a little bit about your background?
How long do we have? No, actually, been practicing for 40 years, to be honest with you. Started out in Louisiana, and I am boarded in surgery and boarded sports medicine and rehabilitation, and am a professor of surgery and performance medicine and rehabilitation at the University of Tennessee. So pretty much that's what I do for a living.
Awesome, thank you. And Dr. Mansfield, can you tell us a little bit about your background and your role at American Regent?
Sure. Well, I was born and raised here in Charleston, South Carolina, where I spent a lot of time with my pony club, hunter jumper shows, as well as doing some eventing. I decided I was going to be an equine vet when I was 14 after seeing my horse's colic surgery. Then I went on and did to University of Georgia for my undergraduate, go dogs, and Tuskegee for vet school. After vet school, I did two internships, one in general medicine and surgery, and then one in advanced reproduction. Then I was in equine private practice for almost 15 years, working on pretty much every type of horse you can think of, from backyard pleasure horses to Amish work horses to high-level show horses. I even spent a couple months in Germany working on sport horses. And along my travels, I got certified in equine acupuncture and veterinary medical manipulation. And about a year ago, I started working as a professional services veterinarian for American Regent Animal Health. And here I provide education for veterinarians and horse owners nationwide. I work on educational programs as well as other modes of educating practitioners and future practitioners.
Great, thank you. Before we start answering questions, I want to remind everyone of our Ask the Horse Live format. We're starting with questions submitted during registration. If you're listening live and would like to submit a question, please do so via the chat window. We'll do our best to get to as many of your questions as possible. If you're listening to the podcast recording of this event and would like to join us live in the future, please visit thehorse.com/askthehorselive to register for notifications. And with that, we're going to jump into our questions. So our first one tonight is for you, Dr. Mansfield. It's from Jen in New Jersey, who wants to know what osteoarthritis means and how does it affect a horse's joints?
So the term osteoarthritis, or OA, refers to joint inflammation, and there are many types and causes in horses. It's also often called degenerative joint disease. It can occur in any synovial joint, and it is the degeneration of the cartilage that is caused by factors like repetitive trauma, historical fractures or injuries, and their poor conformation that can increase stress on joints. It gets progressively worse with age if not treated, and can affect horses of any age, breed, or sex. The predominant clinical signs we see with OA in horses is lameness, but it can be intermittent or recurrent or even slowly progressive. Other signs you often see are decreased range of motion, swelling, heat, pain, but working with your veterinarian to identify and treat these signs early is critical to the long-term outcome and prognosis for OA.
And Dr. Adair, this question is from Jane in Missouri. She asks what signs might indicate to horse owners that their horse is suffering from osteoarthritis. So Dr. Mansfield mentioned a few, but I'm sure there's plenty others that horse owners should look out for as well.
Probably one of the earliest signs that you're going to see perhaps is going to be a decrease in performance, especially if you're dealing with a performance individual. They're just not quite as crisp and clean as what they were. If the individual is not a performance horse, you may just simply notice stiffness before you notice lameness. Sometimes difficulty getting up, difficulty bending their neck. We don't think about it oftentimes, but the neck is full has several joints in it, and so stiffness in the neck. And then, as Dr. Mansfield said, lameness is going to be one of the hallmarks. So your horse is limping. After that, you may certainly notice different swellings or filling of the joints. Those type of situations. The joint just looks different, or it doesn't look like the other one. And that's actually a good point to make, is being quadrupeds, you've got another leg that you can compare to. And so that may help you determine if something's going on in one leg versus both.
Dr. Mansfield, Julie in Virginia wants to know if there's any way to reverse damage caused by osteoarthritis in horses.
So OA is a really complex disease process, and one of the keys is early intervention. While it's difficult to reverse damage caused by OA, there are ways to treat it. The goal in treating OA is to slow the progression of the disease process and treat the clinical signs. One of the things I always encourage my clients to do is perform regular performance exams. When you're having those vaccine appointments, when they're seeing it on your horse on a regular basis, have them check your horse out and see how they're moving, because seeing it on a regular basis really helps us see when things change. Successful treatment and long-term management often requires what we call a multimodal approach. That means using more than one therapy for treatment. There's no one-size-fits-all recipe for OA, because every horse's symptoms, pain tolerance, workload, and even response to therapy is different, which means every horse's management plan is also going to be different. That can include things like corrective trimming or shoeing to reduce stress on joints, encouraging a healthy body weight, traditional drug therapy to reduce inflammation with things like NSAIDs or injections, or chondroprotective drugs like Equine or Legend to help the joints. Some people also incorporate alternative therapies like acupuncture, chiropractic, massage. But the goal is you and your veterinarian figuring out what's the most effective treatment plan for your individual horse.
Dr. Adair, Elaine in Pennsylvania wants to know if you can speak a little bit more about complementary therapies that can help older horses with joint stiffness.
And, when we talk about complementary therapies, it's a pretty wide encompassing term. And oftentimes we think about, as Dr. Mansfield already mentioned, chiropractic, acupuncture. And I like chiropractic or spinal manipulation because if you get right down to it, what you're trying to do is maintain mobility or motion. And so by going in and doing adjustments, by doing nothing more than ground exercises and poles, certainly can help keep your horse's joints moving. Acupuncture, while it doesn't necessarily treat the joint per se, it can help with pain, certainly with that. And then you can get to other modalities. Pulse electromagnetic field therapy has, at least in the humans, shown to be of benefit with knee pain. So there may be some help with bone pain, joint pain in horses. And then after that, a lot of times, a lot of it's just stretching and stretching their joints and flexing their joints. Those type of exercises can help maintain joint health.
Dr. Mansfield, Carol in Pennsylvania wants to know if findings from human medicine influence equine osteoarthritis treatments at all.
It's actually a bit more reversed. Many of the drugs are tested in animals before humans, Animal models are often crucial to understanding the efficacy of potential uses in humans. Horses and humans are actually genetically kind of similar. So horses experience impact on the joints similar to people, making them a very relevant large animal species for testing and a pretty excellent model for studies of OA in humans. They also share some of the same biomarkers for OA. So the horse really is a good model to increase our knowledge for the therapeutic potential for drugs in humans.
Dr. Adair, Lisa in Maine wants to know if topical products are effective for managing joint pain.
There's really only one that's out there that has been shown to at least reduce joint pain, and that's going to be difluraminic acid. The trade name of the one that was out there in horses is Surpass, and it's basically a topical non-steroidal anti-inflammatory drug. And really, that's about the only one. There's a lot of herbal type of compounds. There are aromatic compounds, camphor, peppermint, some of your essential type of oils that provide a cooling sensation to the joint, but they're not really what you would consider pain relievers. I mean, you can get icy hot in humans, and that is going to be more of a topical aromatic that provides a sense of pain relief as a result of the cooling and changing in the surface temperature of the skin. But for the most part, about the only one that's out there is topical NSAID, non-steroidal anti-inflammatory.
Dr. Mansfield, Nancy in New York asked what the pros and cons are of orthobiologics versus corticosteroids for treating joint disease.
So our corticosteroids are really an effective, less expensive first line of approach to treating joint disease. They've been the mainstay of joint disease treatment for decades. And despite some of the negative connotations associated with them, they can be really effective in treating joint disease because of all their anti-inflammatory effects. There have been case reports suggesting that intra-articular corticosteroids are a possible risk factor for laminitis, but there have been a lot of studies that have also shown there's little evidence of that in healthy horses. However, they probably should be avoided with horses with metabolic disorders like Cushing's or metabolic syndrome or insulin resistance, or horses that are at an increased risk for the development of laminitis, aka our overweight horses, or the horses that have had laminitis in the past. Now, orthobiologics are a form of regenerative medicine that are used in treating a lot of musculoskeletal injuries like OA and tendon and ligament injuries. In general, they really have provided us with a really new, exciting tool for our toolbox of potential treatments. It focuses on transplanting cells that have been prepared outside the body into an inflamed or injured joint space in hopes of stimulating healthy cell growth and decreasing inflammation. We have so many orthobiologics out there these days, like stem cells, PRP, IRAP, ACS, APS, alpha-2. The list just keeps going on. And many of these preparations can be prepared stall side, which is super helpful, and some even frozen for later use. But orthobiologics do tend to be a bit more expensive than corticosteroid treatment. But it's important to talk with your vet and discuss what they think is the best option for your horse at their stage of the disease process of OA.
Dr. Adair, Heather, who's in our live audience, would like to know if you have any suggestions for equine osteoarthritis preventative supplements or other strategies.
There really the big thing that we should be directing any type of therapies towards is maintaining joint health. Joint health is going to be crucial to overall maintenance, and not only from and that includes exercise too, because you've got to remember that you've got to move around in order to give nutrition to the cartilage. So any product that may help maintain joint health is what we want. So one of the ones out there is polysulfated glycosaminoglycans, and those have certainly been shown to have an anti-inflammatory action and are incorporated into your hyaline cartilage, which is the normal cartilage that covers the joint. Now, when you get to the replacement cartilage, the fibrocartilage, they tend to be less effective. Additionally, hyaluronic acid that we administer, it can help basically restore a normal joint environment. In fact, I will quite commonly use it post-arthroscopic surgery in my horses. There are supplements out there, oral supplements that are on the market that can also at least we think or have suggestive of stimulating the production of hyaluronic acid, providing other nutrients to the joint. So those type of products can help with the slowing that progression of osteoarthritis.
Dr. Adair, Dorothy in Canada wants to know if there are any products available to slow the progression of joint disease once it's already started.
Yeah, well, once it's already started, I think we need to be realistic about it. You're not going to stop it. You're hoping to slow it down. So again, those products that I mentioned that supply the building blocks for hyaline cartilage, basically what you're trying to do is improve the quality of the normal cartilage that is there. Okay. Once it becomes fibrocartilage, which is the replacement cartilage, their products out there are not very good at actually being incorporated into that fibrocartilage, the replacement cartilage. It's there because there was damage. So what you're trying to do is maintain the quality of the hyaline cartilage. You're trying to maintain the integrity of the joint capsule, because the joint capsule is very important. Synovial membrane is very important for producing hyaluronic acid, which helps lubricate the joint and helps provide nutrition. So those are going to be the two main products that you're going to be, those that affect the cartilage and those that affect the synovial membrane, trying to maintain healthy structures within the joint.
Dr. Mansfield, Ashley in Indiana asks if EPM can affect a horse's joints. Are there any special considerations for managing joint disease in horses with EPM?
So EPM is a really tricky neurologic disease. I saw a lot of it in private practice, and the signs range from mild behavior changes to occasional tripping to horses that were down and unable to get up. The FDA-approved treatments for EPM have not really been studied in conjunction with many of the drugs used to treat OA. Some non-steroidal inflammatory drugs like Banamine are frequently given to the moderately or severely affected horses during usually their initial treatment in an attempt to prevent some of the worsening of the neurologic signs. But every case of EPM is so different, just like OA. You just really need to follow the guidelines and treatment plan that's prescribed by your veterinarian.
Dr. Adair, Doris in Pennsylvania asks how she can tell if a horse with arthritis is no longer comfortable in work.
Well, the primary thing is probably going to be lameness, which, working with your veterinarian to determine, the degree of lameness. Now, I think it's important to recognize, and there's a term we throw out in veterinary medicine that's called serviceably sound. Let's face it, I've been doing this 40 years and I've been stepped on, stomped on, and kicked, and I've got arthritis. without a doubt. And but yet hopefully I'm serviceably sound. I can do my job. And so that's one thing. I think if the degree of lameness that your horse is showing is extremely important. If they're laying down and not getting up or having difficulties getting up, that could be something to see. If they're lagging coming in from with the rest of the herd coming into the barn, if they're slowing down, those are going to be signs that you should look for, and then contact your veterinarian to come out and do a lameness exam on him and determine the degree of lameness. And there may be some things that you can do to treat. But with consultation of your veterinarian, you should be able to decide.
Dr. Mansfield, Julie in Arizona says that she can hear a clicking sound in her 13-year-old gelding's rear fetlocks and wants to know if it's arthritis and could be cause for concern.
So while those sounds may be a little alarming, occasional pops and clicks coming from the joints of a comfortable sound horse usually aren't anything to worry about. They're caused by the same process that allows you to crack your knuckles. But regardless of the location, it doesn't mean a joint's tight, loose, or misaligned. I mean, these days when I stand up, the amount of clicking and cracking I'm hearing is sometimes alarming. But, just like Dr. Adair, I do believe I'm still serviceably sound. Now, some injuries and orthopedic conditions can cause structures of the joint to rub against each other in a noisy manner. But in those situations, your horse is usually going to be lame. So that's when you want to have your vet check it out.
Dr. Adair, Nancy in Illinois wants to know if it's safe for her arthritic horse to be on a low-dose NSAID for several years.
That can be a difficult question to ask. I think it's important to recognize that all NSAIDs, even the more selective NSAIDs, have complications or have adverse reactions. Pretty much all the NSAIDs can certainly damage or cause gastric ulcers, colonic ulcers. They can affect kidneys. They can also cause bleeding issues. So that can happen with any non-steroidal anti-inflammatory, regardless if it's flunixin or phenylbutazone or ferrococtib. It can happen. However, it's going to be less so with certain antibiotics. Ferrococtib is one. Most of the studies that are out there, the longest it's looked at is 42 days. And so at least it was shown to be relatively safe up for 42 days. So I don't recommend necessarily continuous use, but the horses need a break every now and then. But I mean, I've certainly got horses that have been on NSAIDs for a considerable period of time. I've got one of my old thoroughbreds that stays on ferrococtib, and so but I give them a break every couple of months and then restart it. So kind of let the system reset itself. But it's certainly something you want to talk to your veterinarian about. There are blood tests that we can do to look for, say, kidney function to make sure they're not affecting kidneys. You can do blood tests to look for bleeding problems. And certainly you can at least scope a horse and look for gastric ulcers. So that's something to work with your vet on. And if you are going to consider long-term NSAIDs, which there are some cases that in order for a quality of life issue, you're not using them, they're a pasture pet, and we're looking at quality of life, you may have to consider that. And if you do, then you need to work with your veterinarian to monitor your horse for potential adverse reactions.
Dr. Adair, Lois from our live audience has a rescued Amish buggy horse with bad hocks. She gives him Cosequin, ASU, Plus and Furocoxib daily.
Mhm.
She's wondering, should she give him anything else? He is retired.
My first question would be, how is he doing? If he's getting along all right, then no, I don't think he needs anything else. There are other additives that you can do for feed additives. One of the common one is MSM. It's a powdered DMSO derivative. You can buy it in the feed store. It has some anti-inflammatory. I'll be honest with you, I like the omega-3s. I think the omega-3 fatty acids, they do have an anti-inflammatory action. So pretty much all the horses that come in here and in our rehab center, they go on an omega-3 supplement because of its anti-inflammatory. So that is certainly something that I would consider doing.
Dr. Mansfield, jumping back to the topic of NSAIDs for a minute, Judy in Ontario asks if horses with arthritis should remain on these low-dose NSAIDs during the winter months if they aren't being ridden, even if they aren't necessarily on them during warmer months.
So Dr. Adair did a really nice job at summarizing the side effects of long-term NSAIDs. So, they should always be administered at recommended dosage rates. So these doing low dose things, you need to go with the dosage rate prescribed by your veterinarian. But even at those dosage rates, you can still have those toxicities that Dr. Adair mentioned. So you need to make sure you're monitoring things with your vet. But if your horse is sound and happy during the winter months, I would save the NSAID usage for times of acute inflammation and pain.
And I agree with that. I mean, if the horse is happy and trotting around the field, coming in, eating, et cetera, really there's not a reason to give it unless you actually observe an issue going on. It's better not to give than to give if the horse is reasonably comfortable.
Awesome.
And then if they get uncomfortable, you have something to do.
Yep, exactly.
Dr. Adair, Sherry in Pennsylvania wants to know how veterinarians choose the best orthobiologic option for horses with OA.
Boy, and that's a good question. There are so many orthobiologics out there that you have to choose from. I think it depends. A lot of it depends on what they determine the joint itself looks like. If it's something that's a very early, before you have radiographic evidence of disease, maybe you've got a synovitis, which is just inflammation of the joint. Maybe you'd go with a product like IRAP. Whereas if you're going in and you see you've actually got evidence of joint disease, cartilage damage, etc., then you're going to choose something that's going to be a little bit different. I tend personally to reserve stem cells for soft tissue injuries, meniscal injuries, tendon and ligament injuries. And then for the true joint issues where I've got cartilage damage going on, then I'm going to go with another biological, maybe PRP, maybe Prostri, ACS, APS. It's really a lot of it depends on that veterinarian or your veterinarian's experience. I'm lucky I'm here at the university. I pretty much have every one of them. But I have a couple that I feel most comfortable with, and those are going to be my first choice. And then if they don't work, then I will change to a different one. And I think one other thing real quick, I think that it depends also on how many times they have to be administered. And I do think we need to recognize that anytime you stick a needle in a joint, there's always a risk of infection. So anything that I can put into a joint that gives me a longer duration of action I feel like the best.
Dr. Mansfield, Dana in our live audience is curious how long of a break might be appropriate for a horse from equiox. She said that her horse has severe ring bone and has been on the drug daily for more than 2 years.
Usually a washout period, I would always tell my clients of 1 to 2 weeks in between that usually 2-month period would suffice. But you also want to, like I said, as our Dr. Adair said, even while equiox is safer than for long-term use, rather than butyrbandamine, you can still have some of those toxicities occur. So it's important to have your vet be checking blood work and for signs of other clinical problems.
And that's pretty much the same way I'll use it. Every couple of months, I'll give them a couple of weeks off. Now, I do think it's important, and at least in my hands, and you need to chat with your vet about it. But I tend, when I do start them back, I put them on a loading dose just so I can get plasma levels up a little higher. But again, I think it's important to try to get the system to reset. I don't think we have a definite time frame they need to be off of it. I think, at least as far as I'm aware of, there's been no studies out there that show X number of days. And so, I'm very much like Dr. Mansfield. I'll leave them off a couple of weeks and then I'll start them back.
Dr. Mansfield, this one's for you as well. It's from Elizabeth in Pennsylvania, who wants to know how quickly she can expect to see results after her horse received a hyaluronic acid injection.
So the first question I'd have to ask is what kind of HA injection that her horse received, because right now there's 2 FDA-approved routes of administration for HA in the market. One is an intravenous injection and the other is an intra-articular injection. HA is one of those things that naturally occurs in the synovial fluid and cartilage. It's a viscous substance made of glycosaminoglycans that help reduce friction in the joint. Injections are often used to treat that inflammation, help the synovial fluid maintain a thicker, more protective consistency. With the IV HA, in their clinical studies, they saw improvement by the 14th day, some that were sooner than that. And while in the intra-articular studies, the horses showed improvement within about 7 days. But every horse's response to treatment can vary depending on the severity of that OA.
Dr. Adair, Sally in South Africa asks how long treatments of polyacrylamide gel last in horses with arthritis. Do they need to be repeated often?
So polyacrylamide gel, I think it's important to recognize there's 2 products on the market. One's a 2% solution, and at least in the States. 2% and a 4% solution compound. I think it depends on what you're treating, Sally. You can get up to a year of reduced pain associated with it, and I do think also you've got to determine how severe the joint is affected. Certainly, the more severely a joint's affected, the shorter the duration of action that you're going to have. I think it's also important to determine, are you talking about more synovial membrane, soft tissue versus cartilage? I go with the 2% compound gel for more soft tissue, whereas I go with the 4% for the cartilage issues. And so again, it's very variable. It's going to be very case dependent. It's going to be determined based on the severity of the disease. But I've got some horses that I've gotten at least a year, maybe a little longer, with 1 injection. So it just, again, depends on the individual and the severity of the disease.
Dr. Mansfield, Jen in the UK asks if adding omega-3s to her horse's diet could reduce the effects and slow the progression of OA.
Omega-3 fatty acids can be beneficial as anti-inflammatories. They actually have been shown to reduce inflammation and support immune function. They're often recommended not only to help with joint disease, but respiratory diseases, skin allergies, sometimes even reproductive issues. DHA and EPA are probably the most beneficial forms of omega-3s because in a couple of studies with arthritic horses, supplementation with the EPA and DHA increased stride length and reduced some inflammatory markers. So those are the types of omega-3s you should be looking for when you want to add something to your horse's diet. But we really need a little more research to see how much benefit we can expect to really achieve from those omega-3s.
Dr. Adair, Denise in Florida wants to know if there are any risks associated with regular joint injections over periods of several years.
Yes, there is. I mean, as I said earlier, I mean, I think it's important to realize anytime you stick a needle in a joint, there's always a risk of infection. Period. That's a given. So if you accept that risk, after that, my question would be actually to begin with, why are you injecting? What is the reason that you're injecting? Hopefully it's not maintenance injection because there's actually no, to my knowledge, there's no studies out there that show a normal joint needs anything put in it. And so if you're treating, then I do think it depends on what you're treating with. It's very well known that corticosteroids cause chondrocyte death. We know that. Now there are going to be some steroids that are less, that are more chondroprotective or less cytotoxic than others. It also depends on which joint you're injecting. You know, if you're injecting steroids in low motion joints, it's not nearly as catastrophic as injecting high motion joints, such as the tibial tarsal joint or the stifle. So, you know, that's kind of it's kind of a hard question to pinpoint down, but certainly there are risks associated with regular injections, without a doubt. And I would not be injecting joints unless there were I've got a diagnosis that there is truly joint issues going on.
Dr. Mansfield, Joan in Arizona wants to know what she can do to help keep her mare with neck arthritis more comfortable in light work.
So for some of the listeners that are a little less familiar with cervical arthritis, some of the signs we see are regional or generalized muscle asymmetry, stiffness or inability to move the neck within a normal range of motion, sometimes altered head or neck carriage. It also can lead to an altered gait of the front limb and cause pain and lameness. NSAIDs may or may not have some efficacy in treatment of these horses. Equiox can occasionally be helpful in some of the chronic cases, but the truth is the neck is really complex, and especially the pain process. And there is a possibility of a nerve pain component that can sometimes make the medication a little less effective. Some of our alternative treatments for cervical arthritis are things like chiropractic treatment, which can help restore some of that normal joint motion and reduce pain. Therapeutic stretching exercises and acupuncture. I've also had some success with shockwave therapy. While a lot of horses are going to respond positively to some of these less invasive strategies, some horses that will benefit from intra-articular corticosteroids or some of the orthobiologics we discussed earlier. But working with your veterinarian on what combination of these treatments is best for your horse's case is important.
Yeah, and if I may, I mean, that's important because at some point, it depends on how painful they are. You have got to break the pain cycle somewhere to make your other therapies more effective, such as your stretching, your passive flexion, your baited stretches. If they're very painful, those stretches are not going to be effective. And so you may, with your vet, find that you may have to do some type of neck injections, shockwave, as Dr. Mansfield said, those things may be necessary just to break the pain cycle.
Dr. Adair, Robert in Massachusetts asks if there's any groundwork exercises or stretching that he can do with his horse to relieve pain and stiffness from osteoarthritis.
Yes, I mean, in my opinion, keeping a horse moving is one of the primary things. You know, I've had a lot of old campaigners that have bad hocks, and they get a subsolar abscess or something happens, and you have to lay them down for a little bit, and then getting them back is more difficult. Whereas if you keep them working, I think that helps. As I mentioned, baited stretches for the neck. If you've got neck arthritis, baited stretches, ground poles and little small cavalettes are great because that encourages joint flexion, and you can vary the distance between the poles, vary the heights between the poles, and so that's certainly something I recommend. Stretching's a little more, I don't necessarily recommend a lot of limb stretching because it can be a little bit dangerous to the owner. I mean, it can just simply picking up the horse's leg, you can hurt your back. And so I do tend to be a little bit cautious as far as recommending stretches on the limbs, but certainly neck stretches, sternal lifts, getting them to raise their backs, butt tucks where you tickle them on either side of the tail head and make them dorsoflex their lumbar vertebrae. All of those things can help with keeping the joints mobile. And that to me is one of the keys, is keeping that joint moving normally.
Dr. Adair, Ines in our live audience says that 2 years ago, her 2-year-old endurance horse was diagnosed with very early OA in his coffin joint. He is sound and competing. To keep the OA at bay, she's asking if she should spend money on oral supplements or injectables or both.
If he's sound, I would probably stick with oral supplements. Again, I'm just going to point out, anytime you stick a needle in a joint, there's a risk for infection. So if the horse is not exhibiting signs, then I would probably stick with an oral supplement. I do recommend getting with your veterinarian and having repeat lameness exams done and repeat radiographs to see if things are progressing. If they are progressing, then you might start to consider moving on to coffin joint injections. But, you know, I tend to use the KISS principle, which is keep it simple, stupid. And, you know, I start out with more simple things first, and then as needed, I will start adding different modalities in.
Dr. Mansfield, Kathy in Ontario wants to know if Lyme disease can exacerbate OA.
Lyme disease is another one of those really complex diseases, and definitive diagnosis in horses is actually pretty challenging because positive blood work really just confirms past exposure or present infection, but doesn't confirm clinical disease. Plus, a lot of other equine diseases are very similar in clinical signs to Lyme disease. So, like I said, it's really difficult to actually diagnose. You've got to rule out a lot of other diseases that might cause similar clinical signs to get the proper diagnosis. Some horses with Lyme disease develop some lameness, but the 3 most common clinical syndromes we see with Lyme disease include the neurologic form called neuroborreliosis, the ocular form, which causes uveitis, and the form affecting the skin referred to as cutaneous pseudolymphoma. There have been a lot of undocumented clinical signs, often seen by veterinarians and owners, that include stiffness, behavior changes, shifting leg or intermittent lameness, muscle wasting, and even hyperesthesia. While they haven't been really scientifically proven yet, I personally have seen them myself in practice. And the frequent association of a lot of these signs with Lyme disease is definitely plausible because they actually have found the organism in synovial membranes during experimental infection. So that range of clinical signs associated with Lyme disease definitely warrants further evaluation, especially with how the prevalence is increasing across the U.S. in humans, horses, and dogs.
Dr. Adair, Anita in Colorado says that she sometimes rides long, hard hours in the Rocky Mountains and wants to know if it could be beneficial to give her horse Butte or Equiox on those days.
I don't think there's anything wrong with that. I mean, if I'm out working pasture or baling hay or something, I know I'll take a non-steroidal anti-inflammatory. So usually what I recommend to my owners, especially if I've got one that has some OA, I'll usually give them a very low dose of Butte the night before, a little bit of Butte the morning of, and a little bit of Butte the night after. Equiox, though, giving Equiox like that is really not going to work. It takes about 7 days for you to get a steady state plasma level. While there have been some research that shows that you can get effects from Equiox within 2 days, most of them, it's that 5 to 7 day range. So you're really with Equiox are not going to be treating the pain or the uncomfortable aspect of it in a timely manner. So, for those instances, I think phenylbutazone is still the way to go. And I like Butte for musculoskeletal, and giving it like I described the night before, the morning of, and then the night after, and then stopping it should be quite beneficial.
Dr. Mansfield, Brian in Ohio wants to know how glycosaminoglycan can benefit horses with OA.
So glycosaminoglycans are really an important component of many connective tissues, including the tissues of the equine joint. They're found in hyaluronic acid, some of them found in equine joint are hyaluronic acid, chondroitin sulfate, and keratin sulfate. The chondroitin and keratin sulfates are important components of that articular cartilage matrix, which helps make up the articular cartilage in joints. There are 2 types of glycosaminoglycans that are FDA approved for the therapy of joint disease. First is our HA that we talked about earlier. Legend is the IV version, and High-Visc is one of the available intra-articular versions. It's an anti-inflammatory drug that through several mechanisms can help stimulate some HA production, but while it has, it probably doesn't have a lot of direct effects on the disease cartilage, but it helps decrease inflammation in that joint fluid, which helps that synovium. The other FDA-approved product is Adequan, or polysulfated glycosaminoglycan. It can help inhibit cartilage breakdown, stimulate cartilage repair, improve joint lubrication, and decrease inflammation.
Dr. Adair, Skylar in Arizona asks if treating joints with steroids before joint disease develops is beneficial for horses.
The short answer to that is no, it's not. You should not be injecting normal joints with steroids because, as I alluded to earlier, steroids can cause chondrocyte death. And that's a pretty well established fact. It's been shown that way for several years. So doing routine injections of steroids in normal joints, really, you're probably going to actually, over the long run, accelerate the disease because you're actually damaging the cartilage with the steroid injections.
Dr. Mansfield, Elise in Switzerland wants to know what the ideal activity level for foals is. Can too much activity hurt their young joints?
So it is important a newborn foal gets exercise, but you kind of have to go at their own pace, and every foal is going to be a little bit different. The musculoskeletal system in terms of bones, muscles, cartilage benefit from exercise the foal gets when it's turned out. A good introduction for that new foal is turning it out with its mom, and that usually starts a day or two after birth, and you want to gradually increase that time spent outside each day. But something else to keep in mind, depending on where you live, is the climate. If you have really hot or cold temperatures, turnout time really needs to be adjusted accordingly, because those foals do not thermoregulate their body temperatures well during their first few days of life. Also, we know how horses like to get themselves in trouble, so making sure to regularly check your fencing and pastures for anything they could possibly injure themselves on is really important. But some of the signs your foal is getting too much exercise include lameness and changes in the conformation of the legs, which could be some angular or flexural limb deformities, which make the foal's legs look calf or buck-kneed. And these problems can be a result of a combination of growing too fast and too much exercise. At that point, though, you really want to consult your vet on treatment. So exercise definitely is good for foals, but controlled exercise is key.
Dr. Adair, Rebecca from our live audience has a 5-year-old AQHA mare that she shows in all-around events. She has her on a joint supplement, and she's wondering if chondroitin, HA, and turmeric are helpful ingredients for her horse's joints.
Certainly, well, I think you've got to go back to, how much are actually absorbed. Turmeric, we don't know. In humans, there is some thoughts that turmeric can aid in reducing joint inflammation. The hyaluronic acid, it's somewhat questionable as far as how much actually is absorbed through the GI. Chondroitin, yeah, it gets in there. And a lot of it depends, and I think it's important that you go with a well-established product that is actually maybe has some research behind it. There's research studies out there to show that you may not, what's in the jar may not actually match what's on the label. And so you want to try to go with a higher end oral supplement that hopefully maybe has had some research backing. There are some products out there that have had research that back up their efficacy. And so that's what I would recommend for her.
Dr. Adair, Sandra says that she has a horse in her mid-20s who is serviceably sound but has some joint disease. Would it help her horses to lightly ride them to keep them active?
Most definitely. As I said earlier, I think exercise is important. And so it also, when you ride these horses, it also helps for them to kind of build up their endorphin levels naturally. And so by keeping them working, you get an elevation in endorphins, which are the body's natural pain relievers. Additionally, it just helps with movement. And so sedentary animals, couch potatoes, they're going to have a lot more issues moving wise than somebody that is up and active. Same thing goes with horses.
Dr. Mansfield, Tracy in California wants to know if there are any natural remedies for joint disease.
So firstly, a lot of dietary modifications can play a really crucial role in managing joint disease. You want to make sure your horse has a balanced diet. You want to maintain an optimal body weight because you want to reduce the stress on the joints, because our overweight horses really are more susceptible to arthritis. Incorporating supplements such as omega-3s that have anti-inflammatory effects can help with joint health. And as Dr. Adair said, controlled and targeted exercise really is beneficial with horses with arthritis. It helps maintain some joint flexibility and muscle strength. Supplements or herbs can have some benefit in prevention, but they're not really designed to treat joint disease. The scientific data out there is kind of all over the place when it comes to supplements. And as Dr. Adair also said, there have been some lab analyses of supplements that revealed a lot of products kind of fell short on what they actually said was in their label. Some of the more common supplements are things like glucosamine and chondroitin sulfate, avocado, soybean, unsaponifiables, resveratrol, MSM, omega-3s, and there are herbs like devil's claw, garlic, and yucca. But most herbs that I just listed don't have a lot of scientific testing in horses, and not much is known regarding what the safe, effective dose is. So it's important to note that some of these herbs can also adversely interact with some other dietary components or medications. So you need to check with your vet before starting any herbal supplements. Also, some of the herbal ingredients like devil's claw do have competition regulation, so it's important to adhere to withdrawal times.
Yep. Yeah, and that's something important with all these medications that we talk about. You need to really address with your veterinarian if your horse is in competition. Providing adequate withdrawal times, et cetera, is very important.
Dr. Adair, we have another question from Ines in our live audience. She recently asked about her 2-year-old endurance horse. This time she wants to know, to prevent OA in performance horses, is it more efficient or money saving to use daily oral supplements that build up and stay in the system, or IM supplements like Equine once monthly?
If and that's a debatable, it depends on, to me, it gets down to a lot of it, convenience factor. I like using Equine, to be honest with you. I used to use it a lot different than what the label says now. At this stage of the game, I give them 7 shots, and then I don't repeat it until I notice some kind of decrease in performance. I used to give them a dose every week for 4 weeks and then once a month thereafter, but I don't know if there's any benefit to that. So for your injectables, that's kind of the way I use them. Now, as far as oral supplements, you just have to recognize that it is a daily situation. So you're going to have to make sure you've got it on hand. You got to make sure the horse eats it. So, you know, there are going to be some cost differentials too. So I do think looking at it from a cost situation and talking to your vet and determine what's the most efficacious but yet economical.
And just to piggyback on what Dr. Adair said, the dosing for Equine, he is correct when he first said it's the 1 dose every 4 days for 7 doses, and then you just repeat that series as needed. The monthly thing used to be out there, but that, you know, you're only getting a few days of benefit out there, but to get the most bang from your buck, you just repeat that series as needed.
Yeah.
Dr. Mansfield, this will probably be our last question of the night from Braun in Australia, who asks if repetitive work on a circle can predispose horses to osteoarthritis.
So working on circles, both ad lib and under saddle, is an important part of training horses in most disciplines. During these exercises, horses typically lean to the center of the circle to maintain balance, but as a result, the strains placed on the inside limb are different from those of the outside limbs. So those uneven forces on joints and bones can possibly lead to a higher rate of injury and the development of OA. So you need to consider your circle size and the speed of travel when working young horses on these circles. Altering that size and speed during training can lead to improved joint and bone health. But ultimately, when you're lunging a horse of any age, working at slower speeds on larger circles and avoiding overuse of this training method probably is the most effective way to protect those horses' joints for soundness and longevity.
Well, that's all the time we have for tonight. We've covered a lot, and I hope our listeners have learned as much as I have. Thank you, Drs. Adair and Mansfield, for joining me.
Thank you very much for having me.
Thanks so much, Haley.
And thank you to American Region Animal Health for sponsoring this event. And finally, thank you to our audience for listening and sending in these questions. If you're listening to us after the live event as a podcast episode, please rate, review, subscribe, and recommend Ask the Horse Live to a friend. Until next time, from everyone at the Horse, have a great night.